as your cardiologist, I want to talk about something incredibly important today. We're going to move past what we all see in the movies, that big, dramatic, chest-clutching scene, and we're going to talk about what a heart attack actually looks and feels like in real life. Understanding these silent signals, well, it could literally save your life.
So let's just get this out of the way. On screen, a heart attack is always loud, it's obvious, right? But in my world, with my patients, it is so often a much quieter, more confusing event. Instead of that sudden crushing pain, it might just start as this strange exhaustion you can't seem to shake, or maybe a dull ache in your jaw, a wave of nausea you just brush off as something you ate. The movie version is simple, the real version is subtle.
And this right here, I hear some version of this almost every single day in my practice. Patients tell me they felt off for days. They thought they had a bad case of the flu, or that the squeezing in their back was just from a long week at the office. They're explaining away these life-threatening symptoms as everyday aches and pains. And that delay is incredibly dangerous.
So, what are these silent signals? Let's decode the language your body is using when it's desperately trying to tell you something is seriously wrong.
Okay, take a look at this. This table really shows the two very different faces of a heart attack. On one side, you've got that classic elephant sitting on your chest, that intense pressure often shooting down the arm. But look at the other side, the silent presentation. It's just as common, but way more subtle. It could be a feeling of fullness, almost like heartburn, an ache in your jaw or your back, or maybe just a profound fatigue. It's the same medical crisis, but the body's alarm system can speak in very different languages.
Now, this idea of radiating pain, it can be confusing, right? But this analogy makes it so clear. Think of your heart like the center of an electrical circuit. When it's in trouble, that signal doesn't just stay put. The sparks travel along these shared nerve pathways. And that's exactly why you might feel pain in your jaw, your shoulder, even your teeth. It's not random. It's your body sending a signal from an unexpected place.
And this brings us to something that is absolutely critical and honestly not talked about enough: the gender gap. The way heart attacks often show up in women is one of the most misunderstood areas of cardiac health, and this confusion, it has serious consequences.
For my female patients, the symptoms are so often the so-called atypical ones. I'm talking about a level of fatigue so deep that just walking to the mailbox feels like you've run a marathon. It's nausea that feels like a stomach bug, or a weird squeezing sensation between the shoulder blades. These are not minor complaints, you guys. They are major warning signs.
This quote isn't from just one patient. It's a story I could piece together from dozens of them. Because these symptoms don't feel like the classic heart attack. Women try to rationalize them. They blame stress, a bad meal, not enough sleep. And that delay in seeking help, sometimes for hours, sometimes for days, is dangerously common, and it can have devastating consequences.
So here's a crucial point. If you suddenly break out in a cold, clammy sweat, and you haven't been exercising or sitting in a sauna, your body is sounding a massive alarm. Your nervous system is going into overdrive trying to handle the crisis. Please do not ignore it.
All right, recognizing the signs is step one, but what you do in those first 10 minutes, that is what truly saves lives. This is your action plan.
If you even suspect a heart attack, these 3 steps are your non-negotiable lifeline. First, stop whatever you're doing, sit down, lie down. You have to reduce the workload on your heart immediately. Second, and this is the most critical step, call for help. Call 911. Don't hesitate. Third, do your best to stay as calm as you can until help arrives. Your only job is to minimize strain, let the professionals take over.
I get this question all the time. Doc, why can't I just have my spouse drive me to the ER? It's faster. The answer is so important. Paramedics are not a taxi service. They're a mobile emergency room. They can start life-saving treatment the second they get to you, giving you oxygen, aspirin, even using a defibrillator. That treatment, started right there in your living room, can be the difference between a full recovery and permanent heart damage, or worse.
Okay, so now that you have an action plan, let's zoom out a bit. Let's talk about what you can control, because prevention is always the best medicine, and it starts with understanding your own personal risks.
Think of each of these factors as putting a constant, low-level strain on your heart and your whole cardiovascular system. High blood pressure, for instance, forces your heart to pump harder 24/7. High cholesterol can start to clog up the very arteries it's pumping into. Over time, all that daily wear and tear adds up, which is why managing these risks is so incredibly vital.
Look, the numbers on this slide are stark, but you need to see them. Look at this data. Being even a little bit overweight, just 5 to 15%, can literally double your risk of a fatal heart attack. This isn't about how you look, it's about the very real physical burden that extra weight places on your most vital organ. Now, here's a number I want you to remember, because this one is full of hope. 50%. That's how much you can cut your risk of heart disease just 1 year after you quit smoking. It is one of the most powerful, immediate changes you can possibly make for your heart health.
So I'll leave you with this thought. Don't wait for that dramatic, movie-style moment. Your body communicates in whispers long before it ever starts to scream. That fatigue, the jaw pain, that weird indigestion, those are the signals. The real question is, are you listening? Because paying attention could be the most important thing you ever do.